Welcome back to Shaw Spotlight. COVID-19 has closed many businesses, including physiotherapists, chiropractors, and other treatment centers. But there is a way for you to get some help. I'm here with Rob Fanti from Fanti Physiotherapy. Rob, can you tell me what is virtual healthcare?
Virtual healthcare is basically getting healthcare at your home through a remote site, just kind of like we're doing right now, where we're doing a session where we can either do it through video conferencing or through the telephone. So there's lots of different terms that are being used: telerehab, telemedicine, virtual care, etc. But essentially, they're all the same thing, which is just allowing us to connect with our patients or our clients in order to try and help them progress with their situations.
Well, and I know security is always a big thing. How secure is this?
So most regulated health professionals, doctors, physios, chiros, have to use what are called secure and encrypted platforms. So it's no different than what we're doing right now, but the platform that we're using is secure and encrypted through the Canadian standards. Like anything, things can get hacked, but we're taking the best security measures possible for the privacy of all the patients.
Now, when it comes to virtual healthcare, obviously you can't do any adjustments or any kind of movement of the body yourself. So you have to instruct people how to do it themselves, or how does that work? How does the treatment work?
Well, basically, as movement specialists, you're still doing a full, comprehensive assessment with the patient. That includes a very in-depth interview with the patient, because probably 80% of the information is garnished through the interview in terms of directing what your assessment is going to be. And so once you have obtained all that information, then you put them through a movement screen. So you'll get patients to move and bend and walk and sit, and try and figure out where the movement dysfunction is. And then from there, you can educate the patient as to what the best exercises they can use are, different postures, different home strategies, etc.
Well, I know for myself, I had a treatment done and I was kind of skeptical. I was wondering how it was going to work, and it surprisingly works beautifully. Like I recovered and I feel fine now. So I think it's a huge benefit for people who are hurting, who do have any kind of movement problems.
Yeah, a lot of it is, reassuring the patients what the safe things they can do, giving them home, treatment strategies, whether it's you using heat or ice or stretching or proper postures or getting out active. And for a lot of patients, it's just reconnecting with them and knowing that they're cared for, and that we're looking out for their best interests.
So there's obviously many benefits to this type of healthcare. Instead, it's better than having nothing. What are some of the limitations?
Well, some of the limitations are definitely, we're known as a hands-on profession sometimes, and a lot of our patients really want that type of care. So obviously, you can't provide that. Sometimes when, red flags are identified, as we call them in our profession, you can't address those in clinic, so those have to be sent elsewhere. And some patients, just don't buy into the whole, self-care model. And so, you have to work with them as best you can, and ultimately it's up to the patient to determine what direction of care they want to receive.
Now, as a patient, how do you know if your healthcare practitioner is using this type of treatment? How would you find that out?
I guess you'll have to call every individual office. I'm not sure. I know from a physiotherapy perspective, most of the physio clinics that I'm aware of in town are providing some level of this type of care. I know once COVID hit, we jumped on as quick as we could to get the virtual care up and running. There's lots of rules and regulations, as we previously discussed, because of all the privacy and platforms and the college regulations we have. But I would just reach out to the individual clinics or your provider of choice and see, what they're doing.
Now, you've been doing this since for a while, since COVID started. What kind of benefits have you seen? What do you like about this type of treatment?
I've kind of been blown away by the response, to be perfectly honest. It was new and novel for us. So just as nervous as some of our patients are, we were just as nervous as practitioners to deliver this model of care and see what kind of response we were going to get, see what kind of outcomes we were going to get. But as you attested to earlier, we're getting absolutely amazing results. The feedback from our patients and clients has been absolutely remarkable. So we're thrilled that we, kind of jumped on this to try and reach out to our existing patients to try and help them along. And we've had a lot of new patients that are open to this type of care.
Okay, well, Rob, thanks so much for talking with us today about virtual healthcare.
Thank you for having me on, and keep healthy.